Broadcast has arrived. Join Dr. Anayo Umerah and Dr. Anayo Umerah teaching you wholeness and keeping you healthy from the inside out.
For my guilt, you given me life within. You gave beauty for ashes.
So, are you ready? Hello and good morning. Welcome to Ageless Beauty Broadcast. I'm Dr. Anayo Umerah and I'm here with my lead esthetician at Ageless Aesthetics, Christina.
Good morning.
Good morning. And Christina, can you tell our viewers what you do here at Ageless?
Yes, so I am an esthetician and an assistant laser practitioner. So I do a lot of different facial services, skin consultations, and many different laser services.
Laser treatment, yes. So today we're going to be talking about some interesting topics. We are going to be talking about skincare 101. So the basic skincare that you need in your 20s, 30s, 30s and 40s, 40s and 50s, 60s and 70s. So I'm not leaving out the 80-year-old, but I know that you guys will understand what I'm saying. So, but anyways, let's talk about skincare 101. Basic skincare when we're in our 20s. In our 20s, our skin are very supple. We still have the elastin, we still have the collagen. So, Christina, as a lead esthetician, when you see a 20-year-old, what do you do for them?
Typically, well, first of all, I'm going to tell them about the importance of certain things they should have in their skincare regimen. First and foremost, sunblock. For anybody and everybody, the number one anti-aging product that you could put on your skin is some sunblock. Definitely, I know usually clients in their 20s are spending a lot of time outside in the sun, and usually when you're in your 20s, you feel like you're on top of the world. Exactly. And nothing can affect your skin. Your skin is wonderful the way that it is.
Yes.
But sunblock, very important. Cleansing the skin twice a day, and exfoliating the skin and hydrating the skin. Those are really the most basic things: is cleansing, exfoliating, hydrating, and applying a sunblock to your skin.
Okay. So we're not going to spend too much time with the 20-year-olds because most of their problems are usually acne. Acne breakout. So, like she said, cleansing the skin, using sunblock, sunscreen. We recommend anywhere from SPF 30 and above. Skin is still supple. You still have your collagen. You still have your elastin. So now let's get to 30s and 40s. 30s and 40s actually your skin starts to age from 20. Mm-hmm. But then from 30, 35, 40, now you start losing elastin, you start losing collagen, you start losing fat under your skin. The skin will start to dull and to sag. So this is serious business, and this is when you actually start to really pay serious attention on your skincare. So I'm going to start with you, Christina. Mm-hmm. What do you recommend 30s and 40s, and I'll join in.
Okay. So once again, the basic steps that we've recommended for 20-year-olds, you're going to bring into your 30s and 40s. In addition to that, we would start adding in some powerful serums. Once you start getting into your 30s and 40s, what we refer to as cell turnover slows down. So usually when you're in your 20s, about every 28 days, the cells turn over and you have that nice fresh skin that surfaces. That slows down as we get older, so we have to do things a little bit more aggressively in exfoliating the skin to help keep that skin fresh and renewed. But in addition to that basic routine, we would start adding in some serums. Daytime serums, one of the best serums you could add in the daytime is a vitamin C serum. So what a vitamin C serum is, it's referred to as an antioxidant, and a really good way to think of an antioxidant or vitamin C is basically like when you cut open an apple and you let it sit out and it oxidizes and it starts to turn brown. Some people say, well, let's just put a little lemon juice on it to help keep that fruit right. Okay, so that's what we're doing. We're slowing down oxidation. We're helping keep that skin from aging too quickly and the free radicals that cause damage in the skin. Vitamin C works beautifully to combat that, in addition to giving you some extra added sun protection than sunblock alone.
Yes, because vitamin C is a very powerful antioxidant, so it kind of like eats up the free radicals, and the free radicals can be from sun exposure. It could be from environmental. It could be from what you put in your body. It could be from alcohol. It could be from medications as well. And some diseases can actually do a number to your skin. So, like you said, vitamin C is key. So that's number one. Vitamin C, vitamin C, vitamin C. So you cleanse your your skin. You cleanse your face, and then of course, some people tone, and to tone is to balance the pH of the skin, which is good. But the most important thing, if you're going to even skip the toning, is to do the vitamin C. Now, moisturizing the skin is a key. Okay, I love hyaluronic acid, hyaluronic acid, hyaluronic acid. Hyaluronic acid actually plumps the skin. It adds hydration to your skin, and our skin is made of hyaluronic acid. So you're actually putting that back into your skin. So it helps. It gives your skin a good radiant glow. It helps with hyperpigmentation, which is one of the things we're going to talk about today. Um, it helps to add hydration to your skin. So in your 30s, okay, 30, 35, 40, that is when you start your serious skincare regimen. Of course, we have to moisturize, and then at night, retinoids. Retinoids, retinoids, retinoids.
So, as far as cleansing your face, when should you use an exfoliant?
I don't recommend anyone. Well, if you're using a mechanical exfoliant, which would be a scrub, something that you're taking and you're putting on your skin and you're rolling and exfoliating. So we have basically two different types of exfoliants. There's your mechanical and then there's your chemical. Your chemical would be anything that contains a glycolic acid, a salicylic acid, a lactic acid, and even the retinol or retinoids. Those are all exfoliants, but they're chemically based. I don't recommend anyone exfoliate like a mechanical exfoliant any more than 2 to 3 times a week. It can be too aggressive. It can over exfoliate the skin. If you have oily skin, it can cause you to produce more oils in the skin. You're just trying to remove that little bit of surface cells that are on the skin.
So when we say exfoliation, okay, so there is chemical and there's mechanical. So we're talking about mechanical, like
yes, mechanical.
Microdermabrasion,
micro polishes, anything that you can put on your skin that's abrasive, that you're rolling around on the skin to help remove that outer layer of skin, just to essentially polish the skin.
Although we're talking about skincare in the 30s and 40s, there are some 20-year-olds that experience wrinkles. What causes those wrinkles?
So excessive dry skin, okay? Excessive dry skin. So I look at wrinkles as, okay, you have a clay. Okay, when a clay is wet, it's supple and you can mobilize it. Now, when it's out in the sun and dries out, what happens? It cracks. So wrinkles in your 20s, maybe you have a lot of stressors. Some people are supposed to be wearing eyeglasses, but they don't, and they squint, so they have the 11s. It could be genetic. So if let's say genetically you're predisposed to rapid aging, okay, that can predispose you to have in your 20s. So and that should be addressed. So you don't have to wait until, I say you start from your 30s. You don't have to wait until your 30s if you have wrinkles on your face to start. You can actually start and take care of that. And if you need glasses, you need to wear your glasses. Okay. So
and I would like to add too, dehydration. So a lot of people confuse dehydration with dryness. They're two completely different things. Dehydration is a lack of water, and dryness is a lack of oil. So they're two different things that can be easily confused, but dehydration definitely causes the skin to appear dull and lifeless, and you start to notice more lines on the skin. Yeah. By making sure you have a lot of water intake, you're going to notice a significant difference in the brightness and the plumpness in your skin.
Also, if you're using harsh chemicals, okay, so that's why I say to everybody, you have to get a professional consultation for your skincare before you start putting any product on your face. All these products that we'll see online, I will buy. Okay, I remember in my 20s, I had hyperpigmentation, which is darkening, dark spots on your face. I had it from sunburn because I didn't know about sunscreen then. That was back in Nigeria. So I went to this chemist. We call them chemists, and they made a concussion for me. I put it on my face. It burnt my skin, and yes, and I had dark patches on my skin. So be very careful, what you buy and what you put on your skin. We're still on our we're still on our 30s and 40s.
And it's not a one size fits all skincare regimen. Just because your friend is using a product and they say it's doing wonders for their skin does not necessarily mean it's going to do the same thing for yours.
Exactly.
That's why coming to see us, letting us do a skin analysis, letting us recommend what we think is right for your skin type would be the best option to give you an idea of what the best types of products are to use for your skin.
Yeah, and feel free to call us, DM us. Our phone number is area code 478-333-2595. And you can follow us on Facebook.
You did mention the use of vitamin C. What other anti-aging products in your 30s and 40s would you recommend?
Like she said, retinol. Retinol
which is a vitamin A.
Which is a vitamin A.
And then a vitamin B. Vitamin B is very hydrating. And like we said, you just don't go get these things. You have to come in, let's do a skin analysis, a skin consultation, know where the problem areas are. Because talk about the T-zone. Talk about the T-zone.
So the T-zone, so the T-zone, most people don't, I think the majority of people will present with a combination skin type. And basically what that means is you have this T-zone in the middle of your face from the bottom up across the forehead is typically more oily for people. They notice a sheen on their skin halfway through the day. They feel like they have to apply powder just to kind of get that shininess to go away. But sometimes through this cheek area, they notice they may be a little more dry. So that's typical of a combination skin type. Sometimes, and with weather changes, that can change as well. What you're using on your skin in the wintertime may not necessarily be what you need to use on your skin in the summertime.
It's just like makeup. So makeup changes.
The color of your foundation may change because you're exposed to sun in the summertime. You might have to do something a little bit darker. But yes, so things change throughout the season. Seasonal allergies, people that take antihistamines in the allergy season can cause a lot more dryness in the skin that you may not be used to.
Exactly. So now let's get on. Okay, so this is 30s and 40s. So let me get on to the 40s. The serious business. Now we've had babies, we've had hormonal changes. Some of us are perimenopausal or premenopausal. So hormone imbalance play a role. Children stress us out. Work, husband, relationships, all that in combination can do a number on your skin. Stressors actually can show on the skin. And if you notice, some people that have gone through a lot of stress, all of a sudden they age. So we have to put that into consideration. Now, this is the time to add some serious anti-aging protocols to your regimen, and that will be from coming to the doctors to get chemical peels, to get laser treatments, to get microneedling with PRP, to get any other services that we recommend. But the most important thing is adding growth factors to your regimen. So what are growth factors?
Growth factors are.
I just pulled that one on you.
So growth factors, you sure did. So growth factors basically are going to help regenerate at the cellular level.
Exactly.
That's what they're going to do. Usually by the time we're in our 40s, we're doing corrective skincare. We're correcting all the things that we didn't pay attention to in our 20s and 30s. Now we have hyperpigmentation, dark spots on the skin. We've got lacked skin, we've got large pores, we've got all these things, and now we're trying to correct those.
And my number 1, 2, is there a question? Okay, my number 1, 2 growth factor is your blood. So using your blood to regenerate your skin. It's called platelet-rich plasma. and we use it in different, in many ways. And we've seen some of the sessions that we did online, um, where we use the blood to restore the hair, to help with the skin, and what you know, and we can use it also to rejuvenate certain areas. So your blood has growth factors, and we have a way of processing that, which that will be another session. But when you add it to your skincare, it actually is telling your stem cells, hey, we need to regenerate, we need to grow collagen, we need to grow elastin, we need to do what we're supposed to do to heal. So that way, it addresses a lot of things: fine lines, wrinkles. It addresses pigments. It addresses skin tightening, collagen production, and all that. So growth factors are very good. If you're going to be looking for growth factors, you have to go to um, a professional, because some people might tell you, oh, this has growth factors in them, but maybe not. So there are other products that have growth factors. Skin Medica is one of them. It has some growth factors in it. But like I said, what's the best way to regenerate your own cells with your own blood?
Mm-hmm. What are the differences between a facial oil and facial creams? Is it better to use one over the other?
Um, facial, in the way I look at facial oils, they're not necessarily a serum, because you have to understand certain oils, the size of the, I guess you could say, the molecule are so large, they're not going to penetrate into the skin. Facial oils are great to do like facial massage with.
Yeah.
If you want to keep a facial oil on your skin because you find you might be more excessively dry, I would recommend a hydrator first that can be absorbed into the skin, and then maybe layer a little bit of oil or do a massage on that skin with oil afterwards. But I would recommend using a facial oil alone.
Yeah, honestly, I do not like oils
Oils.
on my face.
Yeah.
I really don't.
They just don't penetrate the skin.
Yeah, creams are better. I really don't.
So even though we've talked about the 20s, the 30s, and the 40s, we do have older clients that come in. What is a good regimen for our older clients up in their late 50s and early 70s?
Yeah, we would. Yeah, you're looking at, like I said, this is corrective skincare at this point. This is more. You're really. I think a lot of times when clients and patients are getting up into the years of the 60s and 70s, hydration is a really big thing for them. That's key. Is exfoliating, hydrating. By that point, there might be a lot of sun damage that's starting to come out, but that's been deep in the skin for years. I mean, most of the sun damage that presents itself on your skin when you're in your 40s, 50s, 60s happened when you were in your teens and your 20s. So it's just it doesn't come out until later. So we're definitely going to be treating some hyperpigmentation. I think at that point, overall you want a very nice complexion as you age. And I think once we get up into our 70s or whatnot, just trying to help have an overall clear complexion, even skin tone, and the skin looking really nice and hydrated is a really good option. But we would use advanced moisturizers, more advanced products.
What is hyperpigmentation and how does it come about?
So hyperpigmentation is dark patches due to increased production of melanin. Melanin is, we have it in our body that, especially for darker skin types, we have increased production of melanin. That's why we're dark. So and it can be caused by different things. It could be caused by sun damage. It could be caused by medications. But sunspots, sun damage, laying out excessively in the sun is one of the key ways of darkening of the skin, and that is called hyperpigmentation. And it can occur in patches, it can occur in spots, and it can cover the entire body. So when you lay out in the sun for a prolonged period of time, you're going to have increased production of melanin. Now, ethnicity also matters. Okay, so African Americans, some Asians have higher melanin production, even though they appear white, but they might have more melanin production. Of course, and that's how we classify skin types. So we have skin types 1, Caucasians, to skin type 4 and 5, sorry, 4 to 6, which are African American descent. So did that answer your questions?
Yes.
Okay. Um, there's also another type of hyperpigmentation called melasma, which appears in patches, and this can be due to um, hormone, pregnancy hormone or hormonal imbalance. There's a condition called Addison's disease that causes dark patches to your skin. So when you have these conditions, it's good to come to a provider, a professional, um, and have your skin assessed, because what causes hyperpigmentation for you might not be hyperpigmentation for me.
What are some services and products that can help with hyperpigmentation?
Some services and products. Let me start with products. So my number one to go product is hydroquinone. Hydroquinone and kojic acid, and there's azelaic acid. There's also the retinoids. Retinoids. Those are my number one. I should say hyperpigmentation solutions. And here at Ageless Aesthetics, we do compound a hyperpigmentation cream that has 7% hydroquinone, which I don't think you will get anywhere in the pharmacy, but it's compounded, and we compound it with different things. We compound it with retinoids, and we compound it with kojic acid. One of the main concerns, especially for African Americans, are the dark circles. Um, in the dark circles, which, you know, different things cause that. Okay, allergies are one of the causes of dark circles under the eyes. We have the aging process. Okay, when we've lost the fat pad under our skin, the light reflection actually causes a reflection of dullness around the eyes, puffiness. Um, what else? Did I miss anything here? Okay. And today we're going to be performing one of our to-go procedures called Aqua Gold treatment. As we go along, we're going to be talking about it. We're going to be explaining what we do with this procedure. Okay. So let's do this treatment. Okay, so we're back with our model again, and she does have some hyperpigmentations on her face. She has the under eye circle. What else does she have? That's about it. That's about it. So one of the treatments is Alpha Glow treatment, which is like a customized cocktail treatment that we do here at Ageless Aesthetics, and it's basically micro needling, but it's customized to her. Okay, so we have here little cocktail concocted already. And we're going to use this tiny 24 karat gold to kind of cause controlled damage to her skin. And this will infuse all the things that we have here in the container. Okay, so now we're cleansing the skin. And what do I have in this cocktail for Keisha? I have vitamin C. Like we talked about, vitamin C is a powerful antioxidant which kind of helps brighten the skin. We have some toxins, and we have hyaluronic acid, as well as a hyaluronic acid filler. So what this is going to do is brighten the skin, tighten the skin, help with pores, and just gives her a very nice glow. Any questions? So if you have any questions, feel free to call, to DM us, leave us a comment on our Facebook page, and we'll return your call, or we'll answer your any questions that you may have. Okay, I'm gonna step off for a minute and let her just finish cleansing her. All right, so feel free to ask any questions you may have. We're kind of like, can you kind of zoom in? So this is what we're actually going to be concentrating on. We'll be concentrating on the darkness under her eyes. So Keisha, do you think, have you always had the dark circles?
Mm-hmm. Well, as I got older,
They
they
got darker?
presented themselves. Mm-hmm.
Okay. So would you say it's genetic? Because genetics can cause the darkening if, you know, if let's say it runs in the family.
Probably genetics. I do rub my eyes and have sinuses as well.
Okay. So she has allergies. So that's one of the causes that I mentioned earlier.
Yeah.
Yes, you can open your eyes. So we can start the treatment. Okay. All right. I think we're good with that. So hopefully in the next month we're gonna look at you again and see how this happened. Okay. Thank you for watching. Thank you everyone, and we'll see you next week, next Thursday at 10 o'clock. And we're gonna be talking about acne and acne scars and how we can treat this. So
Mother's Day.
yes.
Mother's Day.
Mother's Day. Okay. Happy Mother's Day. What? Z, say what you just told me.
And we'll also be talking about our Mother's Day special.
Okay. So thank you for watching. We'll see you next week.
Traded it for my guilt. Did it just for me. Have it all. Have it all. Have it all. Say, have it all. God, have it all.
The views expressed on this program are not necessarily the views of the Glory 980 AM, the Glory Media Group, LLC, WDDO AM, its staff, management, or advertisers, but are the views and opinions of the participants of the broadcast.
Well, y'all, there's a little song that my grandmother taught me a long time ago. One day I was sick and I wasn't feeling too good. But she said, son, come on down to the room. Come on in the room. She